Okay, chapter 22 is about the lymphatic system and immunity. Okay, this is the third chapter in this unit. So obviously, after that, we will have an exam. Okay, so lymphatic system and immune system. Do you guys remember we talked a little bit about the lymphatic system before? Do you remember when the blood leaves go in the interstitial fluids and good part of it go back, not all of it, and the rest will go to the lymphatics to clean it. So we talked about part of it before. So we will talk about the rest, including what's a lymphatic system, the lymphatic vessels that carry the lymph, what is the lymph, what's the immune function, how does it work, how the body defend itself, and so on. There are a lot of details that we will talk about in this chapter. So first thing is anything that cause a disease, we call it a pathogen. And the name give it away. Always have this habit of translation. Pathogen. Patho is disease. Gen is generating, right? So pathogen is these organisms that generate disease. It cause disease. These tiny organisms, microscopic organisms, can be virus, bacteria, fungus, or parasites. Lymphatic system, generally speaking, I gave you guys an idea about it before. It's the system that's responsible for our defense. It defends us. Plus, it take the extra fluid that we already talked about in the previous chapter. It take it from there and return it back to the heart. So it return it back to the heart. This is one. And on its way, when it's returning it, it's going to clean it. And when I say clean it, I mean anything. Pathogen, kill it. Virus, bacteria, parasites, anything, right? Anything. How about debris? How about any foreign material? Yes, just clean everything. Anything that's not supposed to be there should be cleaned by the lymphatic system. Okay, so we will talk about the system itself. What does it do? Does it clear up pathogens? Yes. Debris? Yes. Toxins? Yes. Waste products? Anything that's not supposed to be there will be cleaned. And we will talk about the lymphocytes. Do you guys remember the lymphocytes? What kind of cells are these? White blood cells. So we will talk about these being responsible for the specific immunity, the lymphocytes, most of them. Immunity, by definition, is the ability to resist infection and disease. So if you're immune, if you have high immunity, you have high ability to resist. Lymph, this is the first thing, is the fluid itself. Where do we get the lymph from? The extra fluid or extra interstitial fluid. Do you still remember? Part of the blood of the plasma leave and go in between the cells, interstitial fluid, right? Most of it go back to the capillaries. Part of it doesn't go back. This part go into the lymphatic system, right? This is the lymph. It's almost like the interstitial fluid. The only difference is what didn't leave the capillaries in the first place. And I told you guys you have to remember this. Plasma proteins and cells, right? Do you still remember that? So what's the difference between lymph and interstitial fluid? No difference. What's the difference between lymph and interstitial fluid? Both of those and plasma in the blood. Plasma proteins and cells, especially plasma proteins. Clear? Plasma protein do not leave in the first place from the normal capillaries. Okay? Does not, because it didn't leave in the first place to go to the interstitial, which will go to the lymph. It's the same thing. So lymph is the extra interstitial fluid that go to the lymphatic system. We call it lymph. Otherwise, there is no difference between that and the interstitial fluid. Who is going to carry this lymph and bring it to the heart? Lymphatics or lymphatic vessels. We'll talk about it from small to large. As it is moving and going back to the heart, you're not just barely taking it and bringing it to the heart. You're taking it for a reason, right? You're going to stop in different stations to clean it. These stations are called lymphoid tissues and lymphoid organs. What's the difference? Do you remember the difference in 233 AP1 between the organ and the tissue? Remember, you put cells together to make tissues, and put tissues together to make organ. So there is a whole organ that's called lymphatic organ. The whole organ is just responsible for lymphatic and immune system, part of immune system. On the other hand, there are some tissues. Tissues are not organs, right? Tissues are part of the organs. So some organs will have few tissues that also help with the lymphatic system. We call those lymphatic tissues. So we have two types. The organs, the whole organ is lymphatic organ, the whole organ. The tissues, you will see it. It's like, let's say, digestive system, the intestine, for example. Intestine as an organ. Is this part of the digestive system or the lymphatic system? Digestive system, of course. But there are some tissues in the intestine that contain lymph cells and they help lymphoid system. We don't call it organs, we call it tissues, right? Tonsils, this is not an organ. This is some group of tissues in here, right? So if it is just tissues within an organ that's helping this purpose, we call it lymphoid tissues. And then we will talk about the lymphoid cells itself. All of these together are the components of the lymphatic system. So if you look at this picture right here, these are the different organs and tissues. If you look at the thymus, this is an organ. The spleen is an organ. This tissues in the intestine is tissue, not an organ. Tonsils, tissue. So you have organs and tissue. Thymus, spleen, these organs, tonsils, and tissues scattered everywhere else, including the intestine, like malt, because associated lymphoid tissues, we will talk about it. So these are the different organs and tissues. And the lymph is going to leave, which is the extra interstitial fluid, is going to leave, and it will go through lymphatic vessels that are kind of similar to the systemic blood vessels. Do you remember the systemic blood vessels? Large arteries, mid-sized arteries. Do you remember this? And arterioles, capillaries, arterial side, capillaries, venular side, venules, small veins, mid-sized veins, large veins. Do you remember this? Lymphatic vessels is just like the veins. Exactly. You start with capillaries, and you have venules, small veins, mid-sized veins, large veins. What is the largest vein in the body? Superior and inferior vena cava. These are the largest two veins in the body, right? So you start from capillaries and end at these huge, largest veins. Same thing for the lymphatic system. Lymphatic vessels follow the exact same pattern, and we will discuss the details. Look at these now. I talked about the organs and tissues. We have some more of these lymph nodes, just a node, a collection of tissues called lymph node. Look how scattered everywhere it is. It's on the way. Look, like you're moving like this, and you will see a node stopping you. And then move, nodes, nodes, node, node. So these nodes are going to stop the lymph as the lymph is moving. And when it stop it, it will take it, clean it, send it, move. And when you move a little bit later, you will be stopped by another lymph node. Okay? And it will stop you. Clean. Do the work and then move it to next, 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 next. In order to make sure that the lymph is clean, it has to stop by all these lymph nodes. And the lymph nodes have some aggregations. They are more have more aggregations in certain spots. Did you guys do you usually do the what is it called, the annual checkup examination? Did you notice that when you go to the doctor, they always do like this, and here and here? Did you notice this? They feel different spots. This is not random. They feel these aggregations. There are groups here, here. They always do this, right? Because the lymph nodes are here and here, supraclavicular, and here in the axilla, right? And here in the groin. Yes, they are feeling these spots for a specific reason. What is it? Because the lymph nodes are not supposed to be big and palpable. Like if I feel here, I'm not supposed to feel like a bean shaped or structure, something feels like bean or something. It's not supposed to be like that. And if I see it, there is something wrong. Something wrong like what? What cancer is, yes, it's extreme. But does these lymph nodes enlarge? Yes, they enlarge every now and then. If you're infected, you have a virus, you have any even common colds, influenza, everything, that's okay. It's going to enlarge a little bit, swollen a little bit because it is overworking, right? It's fighting. So it has to be bigger. But being bigger, huge, and solid, and stay like that, this is abnormal. Either this person is having chronic infection or, God forbid, cancer. This is the extreme. But that's why they have to. Annual checkup has to include these specific spots. It is the groin region. You will see the lymph nodes scattered, but look at the aggregations here. There are certain spots that have a lot of them, and they need to pay attention to that just in case. Being big and solid means something. Where do we make the lymphocytes? Red bone marrow and thymus, okay? And also the lymphoid tissues and organs in all of these, right? And which one is activated by the thymus? Which lymphocytes? T. So where do we produce T and B? Both in the bone marrow, plus lymphoid tissues. But where do we activate it? This is something else. B in the bone marrow and T in the thymus. Okay, so we activated um, by the thymus, or sometimes it's activated in different organs, lymphoid organs. So lymphatic system, generally speaking, it take the excessive fluid, which is the interstitial fluid, it take it back to the circulation, and as it is doing this, it's going to clean it, kill the pathogens, and so on. Plus, the additional function is to transport. So you're moving anyway. You're moving from this point, which is the interstitial fluid, and going all the way to the heart. If there is something there, you're going to transport it. If there are hormones or antibodies or something like that, you're going to take it on your way and deliver it to the heart. So this also counts towards the functions of the lymphatic system: transport, hormones, nutrients, whatever you see, you're moving anyway. So if there is something there, you're going to transport it. So lymphatic vessels, in short, we call it lymphatics. These are the vessels that carry the lymph from the interstitial fluid all the way to the heart in a tree, like exactly like the venous system. So remember, what's the start of the venous system? We start from the venous capillaries, right? Or the venular side of the capillaries. Venules, small veins, large veins, and then the largest of all, superior and inferior vena cava. Do you remember this? We are going to compare the lymphatic vessels to that. It's exactly the same idea. There are some differences, but the branching is the same, starting from the lymphatic capillaries. What are the lymphatic capillaries? These are capillaries that very first one that's going to pick up the extra interstitial fluid that's in between the cells. It will take it. So where the interstitial fluid extra go to the capillaries first, the smallest of all. And the lymphatic capillaries, is it exactly like the systemic capillaries? We discussed the capillaries before. Do you guys still remember? Including the fenestrated and not fenestrated and sinusoid, if you still remember that. So are these lymphatic capillaries are exactly like the systemic capillaries? No, it is not. There are differences. You have to know the differences. It's not like that. What are the differences? Number one, it's blind-ended. Remember how the capillaries, arterioles, capillaries, venules. So it's open from both sides, right? It's not open-ended. Lymphatic vessels, lymphatic capillaries are dead-ended. There is a dead end closed on one side, unlike the capillaries that the blood go from one side and leave from the other side. This is not the case here. It has dead end. Not actually dead. It's just blind end, or it's closed at one end. This is one. Number two, the diameter is larger. Remember the capillaries we said like it's about 7 micros? This is like double of that. It's bigger. The wall is thinner and it is more flat and irregular. I will show you guys the pictures, but it's not exactly like the capillaries. These are the differences that you have to know. The other thing is we never mentioned valves in the regular capillaries. We mentioned those in the veins, right? Venules and veins. But in these lymphatic capillaries, they do have valve. And this valve is just an overlapping of cells. It's not real valve. Okay, it's like instead of being like this, there is an overlap, goes like this. So the overlap is going to make a one-way valve so that when the fluid, the intercellular or the interstitial fluid, when it go to the capillaries, you don't want it to go back. The pressure there is very low. So it's very easy to go back, right? And what if it go back and stay? What is this condition? What do you call it? If that interstitial fluid stayed, it should leave. Hmm? Not exactly. There is a name for it. When this interstitial fluid accumulates and doesn't leave, it should leave from the lymphatic system and from the venous system. You called it something, but yes, lymphedema. It's called edema, generally speaking. But in this case, it will be lymphedema. It should leave. How to make sure it leaves and doesn't go back and causing edema? Valves. So look at this picture right here. What do you notice between these capillaries and these lymphatic capillaries? These are systemic capillaries. Do you notice the green is wider, diameter is bigger? Do you notice this dead end? It's closed on one side. It's not like this. This starts from the arterioles, goes all the way to the venules. It's open both sides. This side is closed. So wider, blind-ended, or closed end. This is one. It has valves and it is flat. Look how this looks more rounded like this, kind of. And the lymph are thinner and more flat. Did you get the differences that you need to know? Thinner, wider, valves, closed-ended. So because of these valves, the interstitial fluid, once the interstitial fluid, extra interstitial fluid, not all of it, the extra, once it goes into the lymphatics or lymphatic capillaries, now we don't call it interstitial fluid anymore. What do we call it? Lymph. We call it lymph. The lymph will flow from these capillaries and moving until it go back to the heart. We will talk about these, that flow, how it goes. However, there are very specific lymphatic capillaries in the digestive system that I want you to know. You need to know it because this is something completely different. Remember, we're talking about the lymphatic system now, right? Lymphatic system carry the extra amount of interstitial fluid back to the heart, cleaning, right? All of that. But there is some of it, just special lymphatic capillaries in the small intestine that's not doing this job. It's actually just a carrier of the absorbed lipids. This is their function. So you need to remember this. Lacteals. Are lacteals lymphatic capillaries? Yes, it is lymphatic capillaries. Does it do the same function? No, it doesn't do the same function. These are unique lymphatic capillaries, specialized. Their job is transport lipids, lacteals. So don't forget this name, lacteals. Look at this comparison, artery versus vein. We compared artery to vein before. Do you still remember? The diameter, it's more flat and compressed, thinner wall in the veins, more muscles in the arteries. We compare those. Now look at the lymphatics. It looks even more compressed and thinner, even thinner than the veins itself. Look at the lymphatic valves. It just cells, look at this cell and this cell. It's just overlapping to make it like a valve. When it go like this, it doesn't go back. Why? Because the pressure is very low. It will not move. Next, so now we left the capillaries. You either follow superficial lymphatics or deep lymphatics. Superficial lymphatics are these lymphatics on the more superficial, more closer to the skin, and the deep ones are the ones that accompany arteries and veins. Do you remember when you compared veins to arteries? Remember this? Subclavian vein, subclavian artery, axillary vein, axillary artery, right? There is a lymphatic that also follow those, and these are the deep ones. But there is extra, which called the superficial lymphatics. So after the capillaries, you go to the lymphatics. Which lymphatics? There are superficial and deep. What's the difference? The name superficial is more superficial, deep is more deep, but the deep accompany arteries and veins. Okay, so this will be our next part, which is the lymphatics, superficial or deep. The last two, the largest two, what are the largest two in the veins? Superior vena cava, inferior vena cava. How about the lymphatics? Thoracic duct and right lymphatic duct. This is equivalent to superior inferior vena cava. So this is the last ones, the biggest ones, the largest of all, and this is what's going to bring the lymph back, not directly to the heart, but it will bring it to the subclavian veins, and subclavian vein will send it to the brachiocephalic vein to the heart, to the superior vena cava to the heart. Do you remember that venous system? Remember superior vena cava, brachiocephalic veins? Do you remember? Internal, jugular, and subclavian. You guys remember, or it's gone? Superior vena cava, brachiocephalic veins, internal jugular, subclavian. Do you remember this? Lymphatics, those two end up draining into these subclavian veins. And then what? Subclavian veins, brachiocephalic veins, superior vena cava, heart. So did you take the lymph back to the heart? Yes, but through the subclavian, brachiocephalic, and then the superior vena cava. The question will be, and we will talk about it, why do we have two? Like superior vena cava drain the upper part of the body, right? Inferior vena cava drain the lower part of the body. Is that the same here? No, it's a different territory, and I will tell you. They drain different parts, but we will see it. There is something here that's called cisterna chyli. Cisterna is coming from cyst. It's like a wider form of lymph vessels. This is like a wide one to get all the lymph from the lower extremities. And it's going to follow and continue, but it is a unique name that we need to remember. Cisterna chyli. It looks like a pouch. It looks like a dilated part because it receives all this lymph coming from the lower limb and the trunk. Right lymphatic duct and thoracic duct, both of those are the largest. They are going to empty into subclavian. Which is which? The name give it away. One more time. What are the largest two lymphatics in the body? Thoracic duct and right lymphatic. Both of them drain into the subclavian veins. Clear? Which drain to the right and which drain to the left? The name gave it away. Which one drain to the right? Right lymphatic drain to the right subclavian. So the thoracic drain to left. Now here is the distribution I was talking about. It's not the upper part of the body and the lower part of the body. It's not like that. That was in the veins. Here, look at this quarter of the body almost. This part, and I want you to remember this picture because I can ask you um, the right upper limb, for example, is it drained by the right lymphatic duct or the thoracic duct? It's right lymphatic duct. How about the left upper limb, the left hand? Thoracic duct. How about this? The left lower, how about right lower limb, left lower limb, and left upper limb? Thoracic duct. Do you see this distribution? You need to remember it. It's not superior, inferior. It is this part and everything else is the thoracic duct. So obviously, thoracic duct is bigger. What is this green here? Usually the green is the lymphatic system. Which one drain here? What is this? This is internal jugular. This. Right subclavian. So which one is this? Right lymphatic duct. And this thoracic duct. Yes. Lymphedema, the one that you were talking about, lymph edema. It's edema because of an issue in the lymphatic system. Okay? What's edema? We talked about it several times. Extra interstitial fluid accumulating. There shouldn't be extras. Everything that leaves the capillaries should return through the other side of the capillaries and the lymph. If that doesn't happen, it's called edema. If the issue is through the lymph, we call it lymphedema. Did you see somebody having edema before, especially ladies, like the foot is swollen, and if you push on it, it goes away and then come back? This is edema. It's just extra interstitial fluids. It didn't leave for some reason. Depending on the reason, we give it a name. If the reason is the lymphatic system, we call it lymphedema, otherwise just called edema. Now, the cells of the lymphatic system. Lymphocytes, we have two types of lymphocytes, T lymphocytes and B lymphocytes. These are the main one, but there's a third one that's called NK, or natural killers. So it's not two types, it's three types. Okay, you need to remember this, three types, T, B, and NK. All of them, we make it in the bone marrow and other lymphoid organs and tissues, all right? But the activation is the one that's different, specifically B and T, and we talked about it. T is coming the first letter of thymus, and B is the first letter of bone marrow. Natural killer is kind of similar to the T. If you look at any one of these lymphoid tissues and lymphoid nodules, you will notice that there is a center inside. This is the structure that's called germinal center, and this is the one that contains the lymphocytes. And there is a cortex outside. These nodules with that structure is located in the lymph nodes, spleen, tonsils, and other spots. Tonsils. We have different types of tonsils. The one that you see, did you open your mouth before and look in the mirror to look at your tonsils? If you did that before, these are called the palatine tonsils. It's under the palate in the back. Did anybody try to do that before? Open your mouth wide, look in the mirror, see if your tonsils are large or not. If you're trying to do that and you're looking at two pair. This is called the palatine tonsils because it's under the palate. This is two out of the five. The other two are under the tongue. So what do you call it? Lingual. Do you remember lingual means tongue? So there is palatine, lingual, and the last one is just one, not two. Pharyngeal tonsils or adenoids. This is the other name. Tonsillitis is inflammation or infection of the tonsils. Look at this picture right here. We have a model. Looks like this. We will do it Tuesday. Here it is. This is palatine tonsils. If you're looking, open your mouth wide, look in the mirror, try it, and you will see this. It's under the palate. Palatine tonsils. One on the right, one on the left. How about tongue? Yes. Under the tongue, there are two, right and left. The last one is called pharyngeal tonsil, and this is only one. See, these are the five tonsils that you need to know. There is a special group of lymphoid tissues that's located with a mucosa of the intestine. And this is called MALT. And I want you to remember this. MALT, mucosa-associated lymphoid tissues. MALT. Mucosa-associated lymphoid tissues. It's lymphoid tissues associated with the mucosa. Okay? And this is associated with the mucosa of the digestive system. Appendix. Do you see appendicitis before? Right? We know there is appendicitis. And because it's stuck on the digestive tract, we think it is part of the digestive system. It is not. It is not. It's a group of lymphoid tissues that's located in this area. It just happened to be there, but it doesn't do anything with the digestive system. Nothing. No absorption, no digestion, nothing. Just aggregation of lymph nodes in this specific spot. Organs include, so what are the organs and what are the tissues? Organs and everything else will be tissues. Just remember it like this. Organs, lymph nodes, thymus, and spleen. That's it. Anything else that we're talking about are tissues. If you look at the lymph nodes, we'll get it from this picture right here. That's easier. There is a core inside, and there is a capsule outside. First of all, there is artery that bringing the blood in, and vein that's bringing the blood out. And here is the lymphatic that's taking it out. So blood comes in, go to these spaces right here, which contain the cortex containing B cells, and the paracortex, which is outside containing the T cells. So what kind of cells do we have inside this? B and T, and also the phagocytes. We'll talk about this. So once the blood enters, it will go into these areas, and phagocytes and B cells in the medulla, and B cells in the cortex, and T cells in the paracortex. So what are the cells here? Three types of cells. They are going to attack and remove those toxins and pathogens. And the clean, not 100% clean, it will leave through this, the efferent vessel. So this is the blood supply coming in. The vessels are the lymphatic vessels are afferent and efferent. Which one is entering? Afferent or efferent? Afferent. Remember it like afferent, access. Efferent, exit. Can you remember it like this? Afferent, access. Efferent, exit. So afferent, bring the lymph in. Efferent with E, bring it out. Okay, and we're going to stop here.